It's a pleasure to be with you. The title of this talk is Public Health Advocacy. There are no disclosures for this presentation. Objectives include define advocacy and why it's an important tool for public health, discuss pre-advocacy work, review the 4 steps of initiating an advocacy effort, emphasize the importance of casting a compelling vision, review the 8 planning steps for developing an advocacy group, and briefly introduce the concept of strategic mapping. Much of the content of this session is adapted from a book by Marcia Avner, The Lobbying and Advocacy Handbook for Nonprofit Organizations. This book was published in 2002 by the Amherst Wilder Foundation Publishing Center. This would be a good book for any public health leader's library. The definition of advocacy is to actively promote a cause or principle involving actions that will lead to a goal. Much public health advocacy revolves around policy issues, which will be the primary focus of this session. So why should public health advocate for anything? Avner lists several reasons for advocacy, including people working together make a difference in changing laws and policies. Advocacy is a democratic tradition. Advocacy helps societies find real solutions. Policymakers need the input of advocates to make good policy decisions. Advocacy gives organizations and the public a voice. This slide lists some key attributes of advocacy. As in the previous definition, advocacy actively promotes a cause or principle. It involves actions that lead to a goal. Policy advocacy is only one strategy, but not the only one, that will help reach health goals. Other strategies include those that impact the clinical sector and other population-based interventions like social media and community engagement. There are 3 major sets of tools to change risky behaviors: policy, influencing an individual one-on-one, the clinical, and population-based interventions. Policy is developed by local, state, and federal governments, businesses, and organizations. It is an effective tool to encourage healthy behaviors, but must be implemented and enforced to be effective. Clinicians are trained in one-on-one counseling, another powerful strategy to change risky behaviors. Population-based interventions provide another potent behavioral impact and can be divided into 2 tool subsets: social marketing and community engagement. Population-based expertise lies in the discipline of public health. We need to use all of these tools in a coordinated way to change risky behaviors in our populations. Public health leaders need to plan broadly and integrate policy with clinical and population-based strategies to more effectively impact the health and wellness of the population. For example, advocacy is often a part of community initiatives. In those situations, integrating and utilizing public health tools of community engagement, facilitating communities to own their advocacy issues, is extremely important in advancing a policy agenda. Despite common perceptions, advocacy is not always confrontational and associated with conflict. There is a difference between advocacy and activism. Advocacy refers to the act or process of supporting a cause or proposal, whereas activism is the action of using vigorous campaigning to bring about change. Advocacy can be confrontational or non-confrontational. Both types of advocacy are important, but must be used wisely, dependent on the situation at hand. The main point of advocacy is that it is supportive of a cause. In my experience, effective advocacy is often subtle, quiet, and behind the scenes. Activism is often synonymous with confrontational advocacy and is generally visible and in your face. Sometimes activism is counterproductive, undermining the ultimate accomplishment of a goal. It's always important to ask the question, will the action chosen, confrontational or non-confrontational advocacy, potentially win a battle but ultimately lose the war? It takes good leadership judgment to determine which type of advocacy will be most effective to reach the goal. Advocacy issues vary greatly, often based on current events, local issues of interest, politics, etc. This slide is a list of recent advocacy issues adapted from the American Public Health Association website, including healthcare, around access, prescription drugs, mental health, reproductive health, etc. Various communicable diseases. Environmental health, including lead contamination, climate change, water safety, etc. Global health, including refugee and migrant issues. Health equity concerns with racism, poverty, xenophobia, etc. Healthy communities, including affordable housing and community design. Education, injuries and violence, including gun control and suicide. Preparedness, substance misuse, including tobacco, opioids, etc., and other social determinants of health. Obviously, this is not exhaustive and is perpetually changing. A main point is that people advocate for issues they feel are important. Different people, groups of people, or communities commonly have different issues they're willing to spend their time and energy on in active advocacy. Public health needs to identify those community issues to effectively link, integrate, and support on public health advocacy strategies. An advocacy collaborative group on one issue will likely be quite different than a group addressing other issues. There are some pre-advocacy steps to consider. These pre-advocacy steps are often influenced by public health data and analysis. This data may come from numerous sources, including public health and healthcare data, community needs assessments that identify the perceived needs of the community, which may be somewhat different from the analysis of public health and healthcare data. Political environmental assessments that relates to the political stance of government entities and various for-profit and not-for-profit organizations. Assessment of stakeholder strategic plans that give insight into where stakeholders are headed, and data on how allies and opponents invest resources, indicating their underlying beliefs and values. Data analysis should result in an advocacy strategic plan. Advocacy needs in society are always greater than the advocacy capacity of various stakeholders, including public health. The primary target of advocacy efforts will generally align with various stakeholder interests, perceived needs, and resources. This is the area of low-hanging fruit for advocacy where everyone is ready for action. Secondary targets for advocacy are those outside the stakeholders' current priorities or perceived needs. Advocacy strategies for these areas may require plans to increase or expand stakeholder interest. The main point of this slide is that a comprehensive advocacy strategic plan will likely include primary and secondary targets. Since public health advocacy work often involves policy issues, it commonly involves advocating with government structures businesses, schools, and other large institutions. As mentioned before, advocacy can be confrontational or non-confrontational. Non-confrontational advocacy takes time and patience and is not as visible as confrontational advocacy. Non-confrontational advocacy depends on persuasion skills and is often based on relationship strength. Advocacy strategy may involve compromise and patience, obtaining a steady movement toward, but not a full attainment of an advocacy goal. Confrontational advocacy is often more associated with forcing results by use of various political, media, and legal pressures to accomplish a policy goal. Confrontational advocacy occasionally results in the entrenchment of opponents, loss of relationships, and negative impacts on future collaboration. In choosing an advocacy strategy, keep in mind the end goal. Whatever you do, you want to win the war of improving population health, not just one battle. This slide is adapted from a Kansas University article and gives advice on when to choose advocacy. They suggest that advocacy is indicated when experience and research demonstrates no other way to reach the goal. When considering advocacy, a group should be assured that their group has the capacity to accomplish the advocacy goal. The group must also have enough enthusiasm, energy, and patience to persevere to meet the goal. Advocacy often requires a lot of time, particularly on complex issues. In other words, how committed is the group to the task? Basic components of advocacy include survival skills. On controversial issues, advocates will be criticized. Advocates need tough skin. When faced with criticism, Kansas University experts suggest that an advocate remain civil in the midst of false accusations. Stick with the facts and truth and try to stay above the passion of the situation. Don't call opponents names. That will only further polarize and inflame the situation. Try to win them over by persuasion if possible. Understand the issue by reviewing all the sources of data: public health and healthcare data, community needs and political assessments. Review the various stakeholders' strategic plans and the various beliefs and values of opponents. Identify allies and opponents. Engage with opponents. Don't just work with the choir. A goal of effective advocacy is to hopefully influence the beliefs and values of those that don't agree with your position. You can't do that if you don't dialogue with them. Developing relationships with allies and opponents is important. Sometimes these opponent relationships result in compromises that can benefit your advocacy effort. During my tenure as state health officer, we had a different opinion on tobacco control than the business community, represented by the Greater North Dakota Association, GNDA. I had been able to develop a relationship with the executive director of that group through our work in the Healthy North Dakota Coalition. We trusted and respected each other, though we had different beliefs on tobacco in workplaces. The GNDA felt that since tobacco products were legal in the United States, they should not be restricted from being sold in North Dakota businesses that desired to do so. I wanted to control tobacco product availability as much as possible. Due to our relationship, the GNDA director agreed not to oppose our tobacco policy efforts, but would not openly support them either. This was a compromise based on relationship, trust, and respect that helped our advocacy efforts. The final recommendation from Kansas University is to develop an advocacy strategic plan with all this in mind. Development of an advocacy plan will be the focus of the rest of this session. Avner suggests 4 steps to getting started in an advocacy effort. 1. Launch the discussion. 2. Get leadership approval. 3. Identify a planning team. And 4. Complete pre-planning work. Launching a discussion starts with casting a vision. Someone needs to deeply believe that something needs to be done and be able to clearly and convincingly present that vision of the proposed advocacy work to others. In the literature, these people are often called champions of a cause. In this session, we'll refer to them as advocacy champions. Nothing will happen without a champion initiating and leading the effort. De Bono et al., in a book titled Moments in Leadership, stated that leadership qualities begin with a unique vision. Steve Farber, in his book, The Radical Leap, said, "A vision statement doesn't generate energy. Love does. Great ideas do. Principles and values do. But vision from the heart is by definition an expression of love. And not only is that more energizing, it is energy." He used Martin Luther King's "I Have a Dream" speech as an example. I say to you today, my friends, so even though we face the difficulties of today and tomorrow, I still have a dream. It's a dream deeply rooted in the American dream. I have a dream that one day this nation will rise up and live out the true meaning of its creed. We hold these truths to be self-evident, that all men are created equal. I have a dream that one day on the red hills of Georgia, the sons of former slaves and the sons of former slave owners will be able to sit down together at the table of brotherhood. I have a dream that one day, even in the state of Mississippi, a state sweltering with the heat of injustice, sweltering with the heat of oppression, will be transformed into an oasis of freedom and justice. I have a dream that my 4 children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. I have a dream today. I have a dream that one day down in Alabama, with its vicious racists, with its governor having his lips dripping with the words of interposition and nullification, one day right there in Alabama, little black boys and black girls will be able to join hands with little white boys and white girls as sisters and brothers. I have a dream today. And if America is to be a great nation, this must become true. So let freedom ring from the prodigious hilltops of New Hampshire. Let freedom ring from the mighty mountains of New York. Let freedom ring from the heightening Alleghenies of Pennsylvania. Let freedom ring from the snow-capped Rockies of Colorado. Let freedom ring from the curvaceous slopes of California. But not only that, let freedom ring from Stone Mountain of Georgia. Let freedom ring from Lookout Mountain of Tennessee. Let freedom ring from every hill and molehill of Mississippi. From every mountainside, let freedom ring. And when this happens, when we allow freedom to ring, when we let it ring from every village and every hamlet, from every state and every city, we will be able to speed up that day when all God's children, black men and white men, Jews and Gentiles, Protestants and Catholics, will be able to join hands and sing in the words of that old Negro spiritual, "Free at last, free at last. Thank God Almighty, we are free at last." Dr. King didn't have to hand out 250,000 laminated cards, his vision statement at the Lincoln Memorial on that hot August day in 1963. It was pure energy. The speech clearly expressed Dr. King's personal vision. The speech was alive. So instead of reciting a vision statement, feel it. Take it deep within yourself. The vision needs to come from your heart. It needs to say, this is who I am. This is what I believe. This is what I think we can do together if we put our hearts into it. If you can do that, you don't need a document with a printed vision statement because you've become a living, breathing vision. You must deeply believe in the vision of an advocacy effort, or you can't put your heart into it. If you don't deeply believe in an advocacy effort, you won't inspire others, and they for sure won't want to engage. Once the vision is clarified, leadership support must be obtained. Without organizational leadership support, nothing will happen. This includes formal and informal leadership. Avner suggests several issues to address when communicating with informal and formal leadership. Leadership needs to hear and be convinced of the champion's vision. The champion needs to demonstrate how advocacy policy work will further the mission of the organization. This may include discussions around how advocacy can impact policies and legislative funding to positively impact organization programs and services. It's also helpful to discuss how engagement in an advocacy effort will positively impact and build relationships with decision makers and community partners by demonstrating relevance of the organization to the perceived needs of the public. There may be need for additional activities to convince the leader of the benefits of advocacy. Those additional options could include providing further educational inputs on advocacy efficacy. This may include having the leader meet with other leaders who have benefited through advocacy efforts. Provide the leader with information and contacts from national advocacy organizations and encourage the leader to participate in various advocacy trainings. It's also helpful to outline the step-by-step planning process that the organization could adopt to provide a more detailed advocacy plan to the leader. Leaders need to be convinced that the suggested resources applied to advocacy efforts will be beneficial to the organization, meeting their perceived needs. The advocacy champion needs to specify how and what the organization can potentially do to effectively participate in the advocacy effort. This discussion will include some estimate of resources needed to support advocacy within the organization. This would obviously be a rough estimate since detailed planning has not yet been completed. It's also important to discuss negative consequences of not being involved. The goal is to obtain the leader's authorization to organize an advocacy planning team. Let's consider informal groups that exist in all organizations. An organization is really a composition of two or more internal organizations. The more visible formal organization and less visible but also very important informal organizations. Informal organizations provide employees relief from the monotony of formal groups and offer opportunities for personal interactions and development of relationships. Informal organizations can be extremely useful to the formal organization, helping with change and transitions, reinforcing values, vision, and mission, helping to resolve personnel conflicts, providing insight into complex, adaptive organizational problems, etc. Informal groups have informal leaders who initiate action, resolve differences in the group, and communicate beliefs and values to members. Advocacy champions must understand and work with informal groups and their leaders. If they ignore the informal organization and particularly the informal leaders, they do so at the peril of their advocacy effort. Let's review informal leaders briefly. Every organization has respected individuals, informal leaders. These are the go-to people of the informal structure of an organization. These leaders have exceptional skills to influence the organization's members. These individuals are called by a variety of names in the literature, including horizontal communicators, influential individuals in class, opinion leaders, peer communicators, and champions, etc. An advocacy effort must engage and receive the support of not only the formal, but also the informal leadership within the organization to be successful. The third step in getting started is to identify a planning team. Obviously, this step needs to be authorized by the organization's leader. This team should be of manageable size, 5 or 6 people. The main point is to keep the group relatively small. Large groups are hard to manage. Team composition should include decision makers, including formal and informal organizational leaders. This may include the executive director or an administrative officer who is in a decision-making position within the organization. The team should also include an individual with policy experience, someone who has planning, coordination skills and interests, and a recorder or secretary for the group to document the group's decisions and activities. All planning team members must be committed to the advocacy vision and message. Eugene Nida identified 4 levels of identification with the message and vision, including 1. Heard the vision, but no interest in it. 2. Heard the vision and will temporarily support it, but I'm not greatly enthusiastic about it. 3. Heard the vision and am committed to it, but will not commit time and effort to support it. This is not a priority for me. 4. Heard the vision and am committed to it and will commit time and effort to support it. This is a priority for me. Planning team members must be at the 4th level of identification with the advocacy vision. This can't just be another team or committee assignment to them. They need to be passionate about the advocacy effort. Generally, if the vision meets a significant perceived need of team members, they will be at the 4th level of identification with the vision. Team members must be carefully chosen. The planning team then develops and reviews the group's planning steps and sets meeting schedules and deadlines. Avner suggests the following 8 planning steps for an advocacy planning team, including 1. Prepare the planning team. 2. Articulate vision and goals or objectives. 3. Establish criteria and identify issues. 4. Target arenas of influence. 5. Choose strategies and tactics. 6. Design organizational infrastructure. 7. Create a work plan. And 8. Present the work plan. Avner's steps 2 through 5 is essentially developing a strategic plan, so I will consider those together in this session. The first step is prepare the planning team. This includes some basic logistics like obtaining contact information for team members and setting meeting dates. The first meeting should focus on outlining the charge to the team. This would include the parameters set by the organization leader's authorization to proceed with advocacy planning. Discussion around how advocacy will fit with the mission of the organization is essential. The team needs to understand that the work of the advocacy team must stay within the parameters of the organization's mission. If advocacy strays beyond that border, the organization's leader will be greatly concerned. It's also helpful to discuss the organization's previous and current advocacy work. For those not familiar with advocacy, key terms should be defined and discussed. Key definitions are important for the planning team to outline the breadth of approaches available to influence policy and issues. Lobbying is a specific form of advocacy to influence legislation or laws, formal statements of public policy. Lobbying is common in public health policy work. As previously mentioned, advocacy is actively promoting a cause or principle involving actions that will lead to a goal and can be confrontational or non-confrontational. Activism is the action of using vigorous campaigning to bring about change and is often more aligned with confrontational advocacy. Public policy is the aggregate of goals, laws, rules, and funding priorities set by public officials. Public policy determines how governments meet the public's needs and spends public funds. Arenas of influence are the institutions where public policy is decided and includes legislative bodies like Congress, state legislatures, county commissions, city councils, school boards, etc. Another arena is the administrative branches of governments. Administrative branches can implement certain policies through executive orders or administrative rules. The chief administrative officer, like the president, governor, mayor, etc., may have veto authority over legislation passed by the legislative body. The third arena is the courts through litigation. Litigation has been used effectively to influence policies, like the handling of immigrants and refugees, environmental protections, etc. During the initial meeting, the planning team should complete a policy readiness inventory. Completing a policy readiness inventory provides the planning team with key data about the public policy objectives and organizational capacity. Worksheet 1 in Avner's book is a useful tool to gather this inventory. For public policy objectives, questions could include: what are the issues? What is already being done to address these issues? Where are the issues decided and debated? This could include legislative bodies, administrative branches, or courts, etc. What policies need to be changed? Should our group be proactive or reactive? Proactive generally relates to new policies or initiatives that need to be promoted and introduced, where reactive means responding to existing legislation or proposals from other groups. Will advocacy be a one-time effort or long-term? For organizational capacity, questions could include: who are the organizational champions for this advocacy effort? It's likely that the major organizational champions are the advocacy team members if chosen well. How deep is the organization's commitment to these advocacy efforts? Do we as a group appropriately understand the legislative process and structure? If not, some educational sessions may be necessary. What are we prepared to do now? What resources are available to support this effort? Are we ready for media work? This may require engaging media experts and possibly adding them to the team. Do we know the lobbying rules and laws that apply to this effort? This may also require some additional education for team members. The next planning action is to develop an advocacy strategic plan that includes Avner's steps 2 through 5. This strategic plan will create a framework to accomplish the advocacy vision previously defined by the champion and approved by the organization's leader. An efficient strategic planning process that I've used several times is strategic mapping. The strategic mapping process I use was developed by Tim Fallon of TSI Incorporated. More details of this process are discussed in other sessions of the North Dakota Public Health Training Network. Planning groups and organizations can be divided into high and low performance groups. There are 5 basic attributes or principles of strategic effectiveness associated with high performance organizations. 1. There is no relation between the time spent in planning and implementation. In fact, if an organization spends excessive time in planning, they get stuck in the planning loop and never progress to implementation. In those situations, the whole plan becomes to plan. Strategic effectiveness is related to an organization's ability to set reasonable, not perfect, goals and consistently achieve them, which translates into formulating a good enough plan. Insisting on going from good enough to near perfect or perfect often results in the juice not worth the squeeze. It usually takes no more than a few hours of appropriately facilitated strategic planning and discussion to find a good enough plan in most organizations. 2. Once a good enough plan is identified, high performance groups moved quickly to implementation. 3. Both high and low performance groups regularly reviewed their progress, but low performance groups tended to embellish their results, also called result inflation. High performance groups were brutally honest with their evaluation data. 4. High performance groups made real-time adjustments to their strategic plans. Colin Powell said, "No battle plan survives engagement with the enemy. Some things will work, others will not. The advocacy environment is constantly changing." The major point: groups need to adapt and change, or their strategic effectiveness will die. 5. High performance groups focused on results, where low performance groups focused on activities. The low performance groups often said, "We are working hard, therefore we must be doing well." Working hard doesn't always translate into desired results. Strategic effectiveness is the group's ability to set the right goals and consistently achieve them. That usually is accomplished through a common cyclical performance improvement process of 4 stages. 1. Formulate a strategic plan. This is the grand entrance to the cycle. 2. Implement the plan. Remember, a good enough plan, not a perfect plan, is what is needed. 3. Review the plan. This is the evaluation phase. 4. Readjust the plan based on results of the evaluation. Remember, high performance groups were brutally honest with the evaluation data and utilized that data to make key adjustments to their strategic plan. The cycle continues, since strategic planning is not meant to be static but dynamic. It must flex and adjust to be effective. Formulation is the first stage of strategic planning. There are essentially 3 sequential steps to formulating an effective strategy. 1. Assess the current situation. 2. Develop a clear vision, mission, and central challenge for the future. And 3. Formulate a strategic map. The advocacy champion, leader of the planning team, presents the vision. This was the vision approved by the organization's leader, providing long-term direction for the planning team. Strategic planning develops a plan to appropriately accomplish the approved vision. The first step, assessment of the current situation, includes gathering key information to inform the planning process. This assessment would include the essential information gathered through the policy readiness inventory previously discussed. It's important to establish criteria and identify issues before creating a strategic plan. This was step 3 in Avner's list. Criteria will help the group decide which issues to address. The criteria become increasingly important as the advocacy group becomes more active. Criteria should be simple and reflect the mission, vision, and values of the group and organization. Using these criteria, the group selects advocacy issues to address. Issues generally fall into 3 types. 1, already in discussion in public policy arenas. 2, those anticipated to be on the agenda of decision makers. And 3, public policy issues the group wants to initiate. Identifying issues may require some research. This may include discussions with other advocacy groups, external stakeholders, interested political leaders, reviews of media coverage, and the organization's experience and expertise through discussions with program directors, etc. Once issues are identified, prioritization is often necessary to prevent overextension of efforts and resources. Issue selection will likely be a dynamic process, flexing with the external environment. The issues selected and prioritized will set the base for the strategic plan. It's often helpful to define the terms vision, mission, strategy, norms and values, and tactics for those involved in a strategic planning process. Various experts may define these terms differently. These are some common definitions that I use. Vision. What do we want to see happen in the long term? Mission. Why do we exist? What do we need to accomplish over the short term, moving the group toward the vision? Strategy. What do we do? Norms and values. What is important to the group? Tactics. How do we do what we do? This relates to how we behave and the institutions, operations, and work plans we create to help us accomplish our values, goals, and objectives. This demonstrates the physical outline of a one-page strategic map from a strategic planning process. The mission statement is at the top. Why do we exist? What makes our advocacy group different from other groups? What do we need to accomplish over a short-term period to move us toward the vision? Next is the central challenge, the major issue the organization must address to move toward accomplishing the mission, providing a focal point for developing several strategic priorities for the organization as diagrammed. The strategic priorities define what the organization will need to do to meet the central challenge. These strategic priorities would relate to Avner's goals in step 2. The objectives define the specific steps needed to meet each strategic priority or goal. Tactics explain how a group does what it does, the way the group behaves, and the institutions, operations, and work plans, or the way the group organizes to accomplish the goals and objectives. A strategic map is a one-page document. Having a one-page document or strategic map helps one communicate what the group does and is an effective visual aid conceptualizing the direction of the group. Note that there are normally between 4 to 6 strategic priorities. This is not an arbitrary number, but reflects the practical experience of expert strategic planners. There are also potential cross-cutting objectives, the maroon box at the bottom of the strategic map. These special objectives relate to all the strategic priorities. Just being at the bottom of the chart does not relegate this as a less important objective. Objectives or goals should be SMART. SMART is an acronym where the S stands for specific. The goal or objective needs to be clearly stated and should answer questions like who, where, what, and why. The M stands for measurable. What parameter will be used to determine if you've reached the objective or goal? This parameter will obviously inform the evaluation process. The A stands for achievable. Does this goal or objective seem reasonable within available and accessible internal and external resources? The R stands for relevant. Will this objective or goal help accomplish the mission of the group and organization? The T stands for time-bound. When will this objective or goal be accomplished, providing a realistic target and element of accountability? In addition to goals being SMART, an accountable individual also needs to be assigned to coordinate and assure the goal or objective is achieved. Without that assignment, nothing happens. Identifying appropriate arenas of influence is a major part of strategic planning. Where do you need to focus resources and activities to obtain the goal? As mentioned above, there are generally 3 arenas of influence for public health policy work: legislative bodies, administrative branches, and courts. The most effective way to influence public policy is through advocacy and lobbying the legislative body. This is particularly true when trying to influence funding or appropriation priorities. The legislative arena is where broad policies are developed that impact policies like workplace safety, social behaviors, violations of standards, etc. The executive or administrative branch can occasionally influence policy through executive action or orders. Agency directors have some latitude to establish rules to solve problems. If issues can be addressed through executive orders or agency rules, this avenue should be pursued since it is often an easier venue than through the legislative process. Complex issues are usually settled in the courts. Litigation is necessary when legislative bodies have no authority or refuse to act, when federal, state, and local decisions are contradictory, and when there is reason to believe that laws have been violated. Influencing legislative policies usually involves lobbying, that specialized form of advocacy. Lobbying is generally of 2 types, direct and grassroots. Direct lobbying is when a group directly tries to influence elected and appointed leaders to adopt the group's position. Grassroots lobbying relies on educating, mobilizing, and activating the public to persuade elected and appointed officials to support a position. Direct lobbying requires building positive relationships with officials, monitoring legislative processes, and identifying legislative activities that impact advocacy issues of interest. Direct lobbying also relies on providing expertise and information to officials. All of this is done to persuade legislators to support an advocacy position. Grassroots lobbying requires building a base of supports and mobilizing them for advocacy issues. Grassroots lobbying often requires coalition building. Coalition building is covered in other sessions of the North Dakota Public Health Training Network. Both direct and grassroots lobbying are regularly used in public health advocacy efforts. The next step is to design an organizational infrastructure and create a work plan, Avner's steps 6 and 7. These steps would also be defined as developing an operational plan supporting the strategic priorities or goals and objectives of the strategic map. An operational plan considers the internal capacity of the organization and group, and with that reality in mind, creates a practical plan to meet the strategic plan's strategic priorities or goals and objectives. Components of an operational plan generally include how decisions will be made, the role of the advocacy group and how it relates to the rest of the organization. Define group functions like legislative tracking, direct and grassroots lobbying activities, mobilizing support, communications, financial and resource support, and policy recommendations, etc. How the group's functions will be staffed. Job and position descriptions for the staff, group leader, policy coordinator, secretary recorder, and other group members, etc. Without adequate job and position descriptions, individuals knowing what they do in relation to others, the group will not function efficiently. Group impact will not only be blunted, but relationships will also suffer, as members and staff experience confusion as to who is responsible for what. Assigning responsibility and accountability for each function and activity is essential, or nothing will get done. Putting all this together into a work plan describing who will do what and when is essential. After an operational plan is crafted, a realistic resource budget to support that plan must be created. Advocacy efforts are generally not cheap, requiring a significant commitment of an organization's personnel time and money to be effective. As you might expect, an organizational leader will only support an advocacy effort if it will significantly meet the mission of the organization. The last step is to present the operational work plan to organizational leadership for approval. This is a role for the advocacy group leader, who must present the strategic and operational plan as interesting and compelling. This must be done in a relatively short time to meet a leader's demanding schedule. Emphasizing how this advocacy program will positively impact the organization and help it accomplish its mission is critical. The future of the advocacy program depends on the advocacy leader's presentation and the organization's leadership decision. Public health leaders need to possess communications competencies and skills for situations like this. Communications concepts are covered in other sessions of the North Dakota Public Health Training Network. After leadership approval, you're ready to start. In summary, advocacy works if done well. Advocacy efforts start with a compelling vision from an advocacy champion. Leadership support of advocacy efforts is critical. Utilizing Avner's 8 planning steps provides a good framework to organize an advocacy effort.
Take your public health practice skills to the next level. Our specialized certificate courses give you an opportunity to work systematically through a public health topic and demonstrate your understanding of that material in a capstone project. Learn more and sign up at ndphtn.com/certificates.